How's it going, everyone? I'm Alex with Chandler Physical Therapy. Today, I'm going to kind of talk about ASTYM a little bit, going to describe it. We're going to see a treatment protocol for the upper extremity. Now, with ASTYM, it is a scraping technique performed to help regenerate soft tissue injuries. There's a lot of things that can happen at the muscle tendons, muscle bellies, or even certain ligaments. This will help create micro trauma and kickstart the healing factor again. It's a great tool to have that complements manual therapy very well. We want to warm up the tissue. There's several different ways you can warm up the tissue: by a dynamic exercise, using a modality, heat, or even having soft tissue work done before it. Now, with the ASTYM, we're going to warm up the tissue however the practitioner feels it's necessary, and after that, we're going to put cocoa butter just so it helps the tools glide. And we're going to do a certain amount of strokes with certain tools in certain directions. If you come in here with wrist pain or elbow pain, you're going to get the same protocol. The reason why is we're going to affect the whole kinetic chain. The muscle direction doesn't really change if you have an injury at the thumb, the wrist, or the elbow, but we want to make sure everything is in the best possible shape when we are treating you. So we're going to make sure we have that cocoa butter, and then we're going to use a tool, and we're going to go up 2 strokes, and then we're going to go down 2 strokes. We're going to grab our second tool, and we're going to do the same thing. And then we're going to go down. Now, the redness is totally normal just because we're creating that micro trauma and blood is coming to the surface. So we're creating that friction. Now, at certain parts of the body, we're going to do a certain amount of strokes at different angles just to get the tendons at the lateral epicondyle. And again, we're always going to try to use 2 different tools if possible. Okay, I'm going to have you bend your elbow up like this. All right, now we're going to go palm up. And again, you might be coming in here for wrist pain, and you're asking, why are we going to do the bicep? Why are we doing this part of the arm? And again, we are doing the whole kinetic chain. We're trying to make sure everything is uniform. Just because you have issues here, you might be compensating here, creating some fibrosis, just some bad connective tissue. So this will help address all that. Okay, almost done. I'm going to put this towel on your lap, and you're going to go into this position right here. And again, this is just a tool that we have that complements our manual therapy very well to help increase tissue flexibility, regenerate the tissue by creating that micro trauma down to the tissue. Now, if there's a lot of fibrosis, just gunky tissue that's not getting good circulation, you might bruise. Bruising is okay. The reason why is because we're using these certain tools to create that, to initiate the healing process again. It is super important that if a patient is not able to tolerate this, that they speak up. Just because we think a certain treatment is going to benefit them doesn't mean they have to go through it if it's too painful. We always want to work the tissue but not overwork it, because we still need Jason to move his arm. He still needs to write. He still needs to drive. So the last thing you want to do is throw the whole kitchen sink at it and then he can't move it for 3 days. All right, if you have any questions, just leave a comment down below and let us know.